preface this by saying that I'm not a pediatrician. I mostly see adult patients, but I do have some knowledge on it. PVL stands for Periventricular Leukomalacia. This is a birth injury that affects the white matter of the baby's brain, causing neurons in that area to soften and die. Usually this is seen if a baby is born preterm or low birth weight. A lot of these changes are seen in neurons or brain cells that surround the ventricles of the brain. So you look at this brain under certain imaging and you see a lot of swelling, those areas look bright, and that's kind of how the diagnosis is made, along with clinical symptoms. So if the baby is not progressing, if there's regression seen, if there's developmental delay, if there's birth history of trauma or preterm labor, all of those kind of are put together to make the diagnosis. Now, terminal myelination is something that is very common. In fact, you see this in everyone. When you're born, your brain isn't fully myelinated. I can make a separate video on what myelin is, but myelin is essentially the stuff that coats your neurons, makes your brain look white. That's not always complete by the time a baby is born. Usually it takes months for that to complete. So if you do an MRI scan of a baby whose brain hasn't completely been myelinated, it also can look bright and white, just like in PVL. So in this case, how do you tell the difference? Again, like I said, that you have to put the clinical picture together with the imaging. So if there is a history of preterm labor or low birth weight or developmental delay or regressions, that with the MRI can be helpful. Further, if something like this is seen in a baby, usually they are followed by a neurologist, so you can do interval imaging, which is imaging like every 3 to 6 months to see if things are getting better or worse. If this is terminal myelination, the MRI will start to look normal once the baby's brain has developed. Unfortunately, in PVL, that won't be the case. This is actually kind of helpful to look at. When you look at brains, there's 3 different types of imaging we often use. The T1 imaging, where the cerebral spinal fluid or the fluid that coats the brain looks black, that is basically an imaging that's helpful to look at structural abnormalities. Other than that, it's not too helpful. In T2 imaging, the cerebral spinal fluid is bright. This is helpful to look for edema and inflammation. I find FLAIR to be very helpful in general because it is technically T2, but you're getting rid of that bright signal, so it is more helpful and a more detailed view of your brain, and it's easier to appreciate abnormalities on it. There are also specific sequences we look for strokes, brain tumors, MS enhancing lesion, things like that, but for our purposes, we'll look at T1, T2, and FLAIR, and we'll focus on T2 because that is what we're looking at in terms of PVL and terminal myelination. So again, PVL is seen in the setting of brain injury, usually anoxic brain injury, preterm labor, low birth weight. As you can see, there's a lot of bright white signal in the brain. If you look at the left, and also on FLAIR, it looks bright. And this is terminal myelination. As you can see, as the baby gets older, you also see this bright signal, and it gets better from 2.5 months to 15 months. This is why it's really hard to tell the difference just based on imaging alone. You have to look at the clinical picture, see what the baby's doing, get the clinical history, and also follow long-term with a neurologist to see exactly what's going on. So I hope that was helpful. That was a long-winded answer for your very short question.